All day I answer questions, and one of the more common questions, and questions that I get actually on this platform, are about the gel injections, or what's called viscosupplements. So in today's video, I'm going to go over all of the information that is available and the information that I share with my patients when they bring up questions about the gel injections. So stay tuned. Hi, welcome back. I'm Adam Rosen. If you have not already, please subscribe to the channel so you get updates when videos like this come out. And if you enjoy this content, click the like button so people like you that are searching for information like this can find this. In today's video, I want to talk to you about viscosupplements, or the gel injections, or the rooster shot. These are injections that have been around since the mid-1990s. So they are not new. What they are is hyaluronic acid is a component of lots of tissue in the body, but it is a component of the synovial fluid. It's the fluid that bathes our joints. It offers cushion and lubrication, and this can change over time with arthritis. Now, currently, there are a ton of different brands and options that are available if you choose to pursue a viscosupplement injection. The goal of these injections is one and one only. It is to decrease pain. There are a lot of other misperceptions that patients coming into my office have. So people think that these injections do things that they don't. So they do not prevent arthritis. They do not reverse arthritis. They do not regrow cartilage, and they do not change the appearance of your x-ray. The main goal of these injections and drugs is to decrease pain. So if you're curious about these injections and you go online and Google it, like everybody does everything, what you'll find is a couple things. If I use the Google search engine and AI, I can find a input data sort of that shows me that these are helpful and decrease pain. If you can search again multiple times, you can also find AI-generated information from Google that recommends against the use of these, that they are not helpful. Now, each company, if you go online to their particular website, you will see studies and data that show the support of why their drug reduces pain and offers relief. And you'll see percentages, and usually if you scroll to the bottom, you'll find a number of references. And the majority of these time, these referenced studies are studies that are done by their paid consultants. Now, there are other scientific studies that are out there. So this comprehensive study that was done a number of years ago came to the conclusion that viscosupplements decrease pain, and it can improve function and even potentially delay the time or need for surgery like knee replacement in the future. Now, when it comes down to patients asking the ultimate question to me, do I recommend the gel injections? The answer is no. And I'm sure that this video is going to stir a lot of controversy. And I'm sure in the comments, we're going to see lots of comments about people that have said, I can't believe that you don't recommend them. I had them and it decreased my pain. It prevented me from having surgery. It improved my quality of life. And that is possible. But you're probably also going to see comments from people that say that they had the injections and it did not offer them any relief of pain or symptoms. And you might even see comments from patients that say that they've had these injections and had a complication or an untoward side effect. Sometimes it might just be pain or swelling. Sometimes it can be something what we call a pseudo-septic reaction. It looks like an infection. It's a red hot swollen knee as a result of these injections. Now, why do I not recommend these injections anymore? Because I did give them for a number of years. Well, I'm not alone in not recommending these injections any longer. The American Academy of Orthopedic Surgery comes out with clinical practice guidelines about every 3 years. And the most recent clinical practice guidelines for the treatment of osteoarthritis of the knee They form a committee and they came to the strong conclusion that they do not recommend these injections anymore. And they're not alone. In 2019, the American College of Rheumatology also came out with their guideline statement, and they did not further recommend these viscosupplements or lubricant injections any longer. And if you look, there are a number of studies. This one particular study from the British Medical Journal, and they looked at viscosupplement treatment for knee osteoarthritis because it is labeled, all the drugs are labeled for use in the knee. Many times these are used off-label, so you might hear these being used for shoulder arthritis, hand arthritis, hip arthritis, but most of the studies are done around the knee. And what they found, that there was strong evidence that there was an increased risk of side effects when compared to placebo, and that it was a very minimal improvement in pain. Now, most of these studies, whether or not they're done by the companies or these other studies, they're comparing it to a saltwater placebo injection. So here you have a drug that is expensive and has a risk of side effects. And most studies in the recent past have not been able to show a clear, significant increase in improvement in symptoms with these drugs when compared to a saltwater placebo injection. And outside of the United States, even the Canadian Association does not routinely recommend these injections any longer. So when I have my discussion with patients that have osteoarthritis, I explain to them that there are a number of normal recommended treatment options. It's strengthening if you're weak, weight loss if you're overweight, the use of over-the-counter oral medications, occasionally corticosteroid injections. Should all of those things fail, then surgical treatment like knee replacement may be an option based on your symptoms and exam and clinical x-rays and the discussions that you have with your doctor about what is the best option for you going forward to improve both your quality and your function and to improve the pain that you might be having. So I hope this at least answers the question, because this is a question that I've gotten a lot on this forum and in the office. And again, I'm giving you what I tell my patients, but it's just not my own personal opinion. It's my opinion that is in line with other organizations and based on the most up-to-date and current scientific data. So again, until next time, thank you for watching. I'm Adam Rosen. And until I see you next time, stay safe.